Poor oral health is known to be associated with risk of pneumonia in intensive care units and other healthcare settings. Now, there is new evidence to suggest that there is a link between oral hygiene and community-acquired pneumonia. Investigators in the Health, Aging, and Body Composition study looked at potential pneumonia risk factors and identified oral plaque deposits, limited mobility, and smoking as significant but modifiable pneumonia risk factors.
The way we were looking in this study was looking at plaque, and so the main mechanism would be to use toothbrushing as the primary mechanism. Twice a day brushing your teeth, I think, can be helpful for many reasons, but what we found is that it certainly could be helpful for pneumonia, and probably the biggest contribution to preventing pneumonia in this population. We also found that developing physical disability over time resulted in hospitalizations for pneumonia. A lot of times what we couldn't tease out in this study was whether actually preventing disability would be able to reduce pneumonia. However, staying physically fit, staying physically active, trying to exercise, even with things like walking, can improve your health and potentially reduce the risk of pneumonia. And then the third was active cigarette smoking. We all know about the ill effects of smoking on our lives in general. What we found in this cohort was that if they were still smoking into their 80s and 90s, that those patients were at greater risk for developing pneumonia.